working on the presentation. It will come up in a bit, but just to let everyone know that we will be recording this session for your information. And I think to start us off today, we are going to have some remarks from Ben Light, who is a senior technical advisor with UNFPA. Ben.
Thanks, thank you very much, Farhan. Hi, Andrea. Hi, colleagues. Nice to see you all. I hope my internet is going to hold. If necessary, I'll take myself off mute. Really a pleasure to be with you. I've missed some recent meetings of the community of practice. Very excited to be with you all today. Very nice to see many familiar names, if not faces. I just wanted to very quickly, I'll only take a couple of minutes, but I just wanted to let you know that within UNFPA, one of the things that we have been working on for quite some time is a new policy. One of the things that UNFPA does is we mobilize resources and we distribute reproductive health supplies, predominantly contraceptives, that we donate to partner governments. And most of this is done through the UNFPA Supplies Partnership, and the UNFPA Supplies Partnership has an annual budget a little bit over $160 million per year. And 3/4, so about 100 of that, those funds are used to purchase on behalf of governments and a small number of NGOs reproductive health commodities, predominantly contraceptives. The new policy is going to permit, in certain circumstances, the sale of some of those commodities. Now, I should stress that this isn't all signed and sealed. It is something that is likely to be happening during the course of this year, I would hope. I should also stress that there will be some quite there'll be some constraints on sale. It won't be a free-for-all, and certainly the maximum eligible price that would be mandated for the sale of these products would be below the market price. It's really to try and think about what we can do as UNFPA, as part of this community, to take steps towards more viable commercial markets. And I think it's very relevant, therefore, for this community of practice that these changes are afoot. I think my impression for many years is that the work of the donor community in the FP ecosystem is predominantly that there's this donation paradigm, if you like. And I think that as there's more focus on domestic resource mobilization and more engagement specifically with governments to be making their own contributions, of course, as part of that domestic resource mobilization, I think the need to be thinking about the health of markets is coming more front and center. Now, this is something that we in this community have been talking about for many years, and I'm hoping that it's finally going to be bearing some fruits and providing opportunities to us as a community to see what difference this could possibly make. Would this make any difference? Would this help lead to the emergence of more viable commercial partners in the markets? I think there are a lot of questions. And one of the things that we've had to do in putting together this policy is not assume that we know that much. There's a lot of points that we don't have good information on. So certainly in the first couple of years of this policy, I think the sense is that it would be really be rolling out in order to learn and probably to refine the policy as it moves forward. Now, this policy may be of some direct relevance to some of you working for some of the big non-government organizations that are receiving some support in certain countries through the UNFPA Supplies Partnership. But I think the central focus of it is really with our implementing partners that are government agencies. So ministries, different sort of authorities within government. And one of the motivations for this, as we think of making of sort of a more viable market moving forward is also because we know that on occasion the products that we supply are being sold. Now we want to bring that within a sort of authorized policy framework, which currently I think the simplest thing to say is it isn't really. The sense, basically, when UNFPA donates these products, I think similarly to USA, it's assumed that the recipient authorities will get them to the end user at no, with their own resources, and that sometimes, particularly where supply chains are not independently funded, that's simply not happening. So this policy is part of an effort to see what we as a community can do. This is part of the UNFPA contribution to that moving forward. And I'm hoping that there'll be a lot more to say about this as this plan, this policy actually comes to fruition during the course of this year. And I'll be looking forward to saying more about it sometime, as I said, hopefully this year. Anyway, I think that's all for the moment. That's all for me. I'm really looking forward to this meeting now. Farhan, please, back to you.
Thank you so much, Ben. And I think that's quite an exciting update. I'm sure, the community members might have some questions, although you said this is quite preliminary. So, if you are going to be here till the end of the session, maybe if anyone has like a quick question or clarification, please, keep that. And when we get to the discussion section, we can ask that. But I definitely think this is a step in the right direction, especially for the private sector in our market. So thank you so much for that update, Ben. Moving on, so as I believe everyone knows, our focus for this conversation today is a continuation of Nigeria. The first session was held in January, and we decided, based on some of the feedback that we had received, to give some more time to a discussion about Nigeria. So that's what we'll be focusing on today. We have, once again, an exciting sort of panel of presenters, and then we'll go into the discussions. Yes, I believe to start us off today, our first presenter is Maria Saleh, who is the Chief of Party for the FHM Engage project in Nigeria, who will be sharing some of the work that they have started doing in country. So welcome, Maria, take it on.
Thank you, Farhan. Good afternoon, good morning, everybody. So I'll be providing a very quick update on the market description work we've been doing in Nigeria. Next slide, please. Very quickly, I'll look at the approaches, and then we'll just take a snippet from the desk review findings in Ebonyi State. I would like to also acknowledge Solina, who helped to prepare most of the slides. Next slide, please. So we are using the market development approach in Nigeria for our analysis, and then also looking at the entirety of the work that we're doing. I believe in January, the market systems framework was presented. Right now, we're in the diagnose phase where we are trying to identify and understand market challenges, the root causes, and potential opportunities for the private sector. Next, just push one more. Yep, and then we've completed desk reviews. I'll be sharing some of the findings from Ebonyi State. This time we'll be looking at the maternal newborn health markets. The family planning findings are ready, but we haven't gotten approval to share them yet. We have also conducted expert interviews, and through these key informant interviews, we have been able to obtain in-depth insights into contexts in Ebonyi State and the FCT where we work. Next slide, please. Right now, as I mentioned, we've completed desk reviews for the maternal newborn health market. We've completed the family planning as well as the child health market desk reviews. Key informant interviews are wrapping up. I believe by the end of this week, we would have completed all our interviews. Already, we are getting some insights from both Ebonyi and FCT. We will then move to finalize our reports. This should be ready sometime in May for both FCT and Ebonyi. Next slide, please. Next. So just a quick summary of the desk review findings for the maternal newborn health market. Next. So Ebonyi State is a very rural state. About 25% of the population live in urban areas. The rest are in rural areas. A large proportion, I think there's a bit of the slide that's missing with the figures. A large proportion of the population live below the poverty line. I believe it's almost 80%, and it's a very young population with about 40% being less than age less than 15. Next slide, please. So we've conducted a desk review looking at the mixed survey from 2021 as well as the NDHS 2018. While Ebonyi State seems to be performing above national average and maybe lagging behind a little bit in the Southeast region, we noticed some differences between the mix and the NDHS surveys. And for the rest of the analysis, we tended more to rely on the NDHS. Looking at the continuum of care from antenatal visits all the way to newborn care, cord care after postnatal care, we can see that coverage exceeds national level, with ANC being very high, but then there's a massive dropout at ANC 4. From the key informant interviews, we're learning that some of it may be related to costs, where women initially go to the hospital and then move on to a traditional birth attendant. We also see a drop-off at skilled birth attendant in Ebonyi State. It is quite high. For newborn care, postnatal care, it is below the Southeastern average, and same for thermal care and cord care. Next slide, please. So we can see, so this slide just shows the differences across both the mix and over the years for the mix and the NDHS. So from 2008 to 2018, looking at the NDHS, we can see there's been 14 percentage points more coverage in terms of ANC, at least one ANC. The figure for ANC 4 is not available. Similarly, we see a 6 percentage point increase for skilled birth attendants as well as for postnatal care. But what is very clear is that the difference we can see between the mix and the NDHS is significantly different, except for postnatal care. Next slide, please. So another thing we noticed is that there's quite a bit of a drop-off across both the mix and NDHS. Circle there is the difference between the ANC and skilled birth attendants. We can see that we're losing about 42% of women from the first ANC care to the time of delivery. We see a slight increase in terms of institutional deliveries, but then it drops again for postnatal care. And then by the time it gets to postnatal care and initiation of breastfeeding, we've lost majority of the women. Next slide. So this slide just shows some differences across educational qualification, geography, wealth quintile, and age. Overall, for ANC, there isn't that much of a difference except for educational status. Next slide. And then for skilled birth attendants, there's quite a bit of a difference amongst women with no education and those of the highest level of education. Amongst the wealth quintiles, those who are wealthiest deliver in the hospital, while the lowest level are less likely to deliver in the facility. Next slide, please. And then for postnatal care, I think generally we can see that many women in Ebonyi State do not access postnatal care, at least within 2 days of birth. And this is irrespective of geography and to some extent even educational level. Next slide. So based on the desk reviews, and we are refining this further as the key informant interviews are being completed and we're gaining more insights. We're able to create a profile of a typical woman in Ebonyi State who is using maternal newborn services and those who do not use services. We can see that the market is failing about 42% of women who need skilled birth attendants and up to 64% who need postnatal care. Based on the analysis, we have about 163,000 women who require, who already access antenatal care, and then about 11,000 who do not access care. However, these figures seem to be dropping as we look at skilled birth attendants and postnatal care. We have defined the profile of a woman who is more likely to use maternal health services as one who lives in the urban area. She's educated beyond the secondary school level, and she's of middle or higher income level. She also tends to be a little bit older in some cases for young women. And those who do not use tend to be in the rural area, has no education, household income is quite low, and then she's also a bit older or much younger. I think it's a similar profile across both skilled birth attendants and postnatal care. I believe this is the last slide. Yes, thank you. So this is just a snippet of what we've been up to. Within the next few weeks, we'll be updating the slides with insights from the key informant interview. Thank you.
Thanks a lot, Maria, and we look forward to hopefully in a future session to see more of these results and the family planning, related and specific results as well. I do think that there is, value in us sort of thinking about, as a group, the connection between family planning and maternal and newborn health. Recently, I've seen some conversations come up where people are talking about the fact that we have a lot of maternal and newborn health challenges, related challenges in Africa because we aren't doing a good enough job at family planning, or that there are challenges with regards to family planning, and that we need to figure out how to enhance some of those efforts related to family planning so that we can also have better maternal and newborn health results. So there's definitely some thinking that needs to go into that, and happy to have a bit of a discussion later on. Just as a reminder to everyone, please feel free to put down any questions, thoughts, comments, ideas in the chat, and we'll go back to them when we are having the discussions. Moving on with our presentations today. Next up, we have Mopa Isuga from US Pharmacopeia, who will talk to us a little bit about the work they are doing with the PQM Plus initiative.
Okay. Okay, thank you. Can you see my screen? Can you see the slides?
Yes.
Yes, Mopa, we can see them.
Okay, sorry, this is an impromptu presentation, but I decided to put a few things together. So let me just take us through, I'll talk through some of the slides here, and then
Yes, Mopa, you can go ahead. If
okay,
you are
then.
just able to put them as a slideshow, I think that will be clearer for people.
Okay, yeah. Okay, then let's go that way. Fine, great. So, in terms of outline, the program goal objectives and then a few achievements. I'll walk you through what we do specifically with manufacturers, and then we'll talk about other stakeholders that we're engaging in country. So what we do overall, the overarching goal is a USAID funded project, and the overarching goal is to sustainably strengthen medical products quality assurance systems in low and middle income countries. And we try to achieve this by providing technical assistance to medicines regulatory authorities. And for us here in Nigeria, that includes NAFDAC and the Pharmacy Council of Nigeria, known as PCN. And of course, we engage with manufacturers in country on some to be able to produce quality assured medical products that cover malaria. For us in Nigeria, that covers Nigeria and malaria, and specifically maternal and child health. But the overall program, the global program, also these other products form part of our portfolio. But in Nigeria, we are currently supporting malaria and maternal and child health medical products, and then support the national medicine regulatory authorities in development of institutional development plans, amongst others. So we have 5 major objectives as a program: governance in medical quality assurance systems, regulatory systems to assure quality, strengthening the regulatory systems to assure quality medical products in public and private sectors, support the entities in optimization of resources so that they are able to deliver on their mandates, and of course, support supply of quality assured medicines for public interest. And then, of course, we have what we call medical products quality assurance learning agenda and operational agenda advanced. So PQM Plus is a follow-on of the previous program known as Promoting the Quality of Medicines. So in the course of our work in Nigeria, we've been able to support 4 laboratories, drug quality control laboratories of NAFDAC, to be able to attain the ISO 17025 accreditation. And this is important for the country because we now have labs that meet international standards. That simply means that results from those labs are reliable internationally. We also have having to support laboratory of the National Institute of Pharmaceutical Pharmaceutical Research and Development. Is an institute set up by the federal government to support the pharmaceutical sector industry. And one very important component of such an institute will also be a laboratory. Research laboratory, they also provide services to clients, especially from the industry. So becomes important, imperative that lab is also operating at international standards of ISO. So we have also supported manufacturers of various products. Let me just move on. Let me just run through this now. So looking at core activity as relates to manufacturers of essential medicines, our approach is both technical, essentially technical with the manufacturers, and the endpoint for the products of interest is to be able to support the manufacturers to attain WHO pre-qualification for the products. So this is just the process we take them through. We have the chemistry and manufacturing control, where product development is done. We review the dossiers they have, and where is the efficient, we're able to provide support so that they can submit a compliant product dossier for WHO PQ assessment. In a nutshell, these are the list of companies we've supported and are still supporting in country. So with no particular order of preference other than alphabetical, we have about 8 companies that we are having direct technical assistance with. We have Daily Need Group. Product of interest here is amoxicillin dispersible tablet. We also have another company that also produces amoxicillin dispersible, and that's Nimel. We have Emzor Pharmaceutical Industries, and medical products that we are working with them on sulfadoxine pyrimethamine, which is indicated for intermittent preventive treatment of malaria and pregnancy. So we also have zinc sulfate dispersible tablet, as well as oral realization salts, clohexine gel, artemether lumefantrine, again also amoxicillin dispersible, misoprostol, and then a ready-to-use therapeutic food, which is the RUTF. For Juhel, we have two main products: oxytocin injection, magnesium sulfate injection. And Baker is majorly anti-malaria, artemether lumefantrine. And then we have Swiss Pharma, also producing sulfadoxine pyrimethamine and zinc sulfate dispersible. And the last company there is Pharmatex, that is also into production of artemether lumefantrine. So these are all snippets of some of our activities in some of the companies as we engage. We also do capacity building for professionals in the industry. So this is just one of such activities where we engaged in. We did a training for the industry on dossier compilation, and we also attended the PMG-Man Quality Managers Workshop, where we made a presentation on supplier qualification and data integrity for the industry. So yeah, the journey towards WHO pre-qualification, these are areas where we are giving good support, strong support for TA to the companies. Thus far, we have 3 companies that have submitted dossiers. Some of these have not, that have submitted dossiers to WHO PQ4, and they are at various stages of evaluation. Out of this, Swiss Pharma has already gone ahead. Apart from dossier being evaluated, they have also been inspected by the WHO PQ team. SWIFA and Emzor have passed through that stage, and we'll be following up with them in developing corrective and preventive action plans to address the audit findings. For drug field that is highlighted in green, there is clohexidine gel, and this is classified as life-saving commodities under the WHO classification. So it doesn't qualify for pre-qualification, but rather they have been able, through our support, they have been able to attain a regional certification for the product. And so they have approval across ECOWAS to be able to market and register or attain market authorization for their products with little delays in terms of dossier evaluation. So that is ongoing. These are some of the things we have done with manufacturers. I've talked about this already. And we have this activity, we call it the state level quality assurance and regulatory systems. The idea behind this is to address challenges within the medical product supply chain in the country. And what we know is that most Nigerians pay out of pocket for their medical or health needs, and most times the first port of call is either the community pharmacy or what you call the patent medicines vendor. And we know that at that level, some of the practices are not compliant, and in some cases, you find situations where, especially at the patent medicines vendor outlets, there's a tendency to have substandard and, in certain cases, falsified medicines. So along that line, we are working with the Pharmacy Council of Nigeria. And what are we doing? We're advocating for more registrations. We engage with the professional associations and trade associations at that level, where we bring them to a situation where they come under the umbrella of the regulator. because the more the more the numbers that come under that the regulators ambit, the more the level of compliance and ultimately increase access to quality assured medicines at the community level. We're also aware that they provide a family planning services at that area. So we engage and build capacity on quality assurance aspects of supply chain, sourcing, transportation, storage, and a whole lot. So those are, in a nutshell, some of the activities we're engaging in country. And this is just a list of some of our stakeholders that we're engaging in the country, including other USAID implementing partners. Over. Thank you.
Thank you so
Thank
much,
you.
Mopa, for that. Yes, personally, local manufacturing is something I'm quite passionate about, and I'm sure we'll have a very robust discussion later on. Thank you for that presentation. Moving on, we will now have Amina Jafar, who will talk to us about some work that SEMA is doing in Nigeria. Welcome, Amina. Amina, if you are speaking, we can't hear you.
Hi. Can you hear me now?
It's very faint.
Is this any better?
Yes, yes, much better. Thank you.
Okay. So hi everyone. I am Amina. I'll be speaking on SEMA's work that's happening in Nigeria to kind of introduce SEMA and just speak on the work that we're doing on the SRH markets, or to support the SRH markets for the country. So next slide, please. So as I think was presented in the last slide, SEMA basically was launched in 2021 with the mission of supporting the country, supporting countries and global partners to design and drive coordinated data-based strategies that shape healthy, equitable, and resilient markets capable of meeting communities' diverse needs. SEMA is currently working across three countries: Nigeria, Senegal, and Burkina Faso. Today's focus, as today is based on Nigeria, will be based on Nigeria. For Nigeria specifically, we're really trying to look at how we can, support healthy, resilient, and equitable SRH markets in the country, with the aim of being a lifeline or a go-to for the country in providing them with technical expertise as well as information to help them build their market stewardship. Next slide, please. So I know that in the last call, a lot of this had already been presented on the preliminary health, the preliminary markets, national healthy market frameworks that had been done across the different states in Nigeria. So I won't spend a lot of time on this. I'll just speak to some of the summary findings. I think some of the key ones that have resonated with us since the last presentation, as well as following some additional consultations with the national government. So next slide, please. So we had conducted an assessment, as I mentioned, across 5 states, Lagos, Kaduna, Niger, Ekiti, and Osun. And these were done to really understand the market conditions as well as the market foundations. Under the market foundations, I think one of the key things that has come out for us in terms of the condition for resilience is, as we just spoke about and just heard in the last presentation, was that lack of local production for family planning commodities, as well as for RH commodities as a whole. We also have issues around affordability as some of our key findings. We know that for the public sector, we have free FP products, but that has limited some competitive and sustainable pricing, as well as created some access barriers in some areas. We also know that the private sector is subsidized with some SMOs. So a lot of SMOs are working across the country to provide some subsidies, which is leading to some markups in the private sector. And then we have some supply chain, on the supply chain aspects, we have very limited data available on FP demand. And private sector data is not necessarily used for quantification when we know, as our previous speakers had mentioned, that about 70% of family planning is taken up at the private sector. And so how are we sure that the data that we are collating and what we're looking at for our quantifications as a country is sufficient to really meet the needs and the demands of the women that we are trying to serve? Next slide, please. Under demand, still speaking to our insufficient funding to meet the demand, the current gap for FP procurements in Nigeria this year is about 69%. That's the funding gap that we have for FP commodities. And so we have this huge gap, but there isn't as much, we have this huge demand where we don't have as much funding to really, close this gap. There's been a lot of work that's happened in country to try and support increasing domestic resource mobilization. And that's one of the things that I know is definitely being done and has come out very strongly from this assessment across the states. We also look at quality. When we look at quality, there is quality of the products from the national supply chain is considered very good because we have UNFPA as our procurement and supply agent for the country. However, when we look at other commodities, specifically for reproductive health, there is a bit of a gap because states are responsible for their commodity procurements. And when states are responsible for commodity procurements, there's limited quality assurance in terms of what is being procured. And there is less standardization across the country in terms of what commodities are being procured at the various state levels. For innovation, we see that there is product into innovation and introductions are mainly partner driven. So a lot of new commodities that are coming into the country are donor and partner driven. A lot of those are happening at the national level with not as much state ownership. And so there's definitely that need for FMOH to be strengthened to provide that oversight, as well as state ministries of health to really actively participate in product introduction. A lot of the commodities that are introduced at the national level, but are being utilized at the state level. And so having that state level engagement in introducing commodities and in playing a part in these introductions is deemed to definitely be one of the key gaps that we're finding in some areas that we feel require additional support. I will move on now to the market foundations. Next slide, please. So under market foundations, we were looking, if we look under the buckets of data availability, as I mentioned, there's a lack of total market data. We have public sector data, but there isn't as much private sector data, specifically in the 5 states where we've looked. We've had very limited data that's come out. There's also limited insights into SRH products provided through the private sector. So not having that access to data really means that we're not being able to have a full view of the insights of the SRH market, and we're seeing very limited information for only about 30% of the population who are accessing their services from the private sector. As I also mentioned, there's very limited use of private sector data for quantification and forecasting because that data doesn't feed into national data sources such as the DHIS2. So it's a bit difficult for us to have that access to that information to help us to have an understanding of what it is that is happening and what the demand and what the availability and what the true trends may be in terms of users of use of the commodities across the country. For institutional base as another market foundation, we see that there is definitely need to strengthen government capacity for market stewardship, as well as just increase private sector engagement. This finding, I think, was very interesting and has come at a very opportune time because the Federal Ministry of Health is currently making active efforts to do this. And I think that it's also, it's important that the private sector is pulled in to the overall market, considering that they are providing these services to such a large number of people. The FMOH also have recently created at the national level again a strategy for private sector engagement for family planning. However, there's still that need to really ensure that there are linkages at the state levels as well as adoption of these policies and these guidelines at the state level. And so those are other gaps that are coming to light as we continue to dig deeper into the data that's being collected. We are looking at the, some key market functions are missing or really require strengthening, especially at the state level. There's like weak implementation. We don't have sufficient, some strong policies that really support state level procurements. The FMOH recently supported the development of state level guidelines for state level procurement, but it's been developed, and so states are now starting to utilize that, but the adoption isn't as wide as we would like to see. And so this is definitely an institutional base that can be strengthened through additional support and additional efforts. Next slide, please. When we look at like analytical tools, there are limited ones in scope to really assess the total markets. Not a lot is being done at the moment at state level and national level to look at our markets and to really see, what is happening, what does the data look like, what are the priorities of our markets? How do we shape our markets? Where are the areas? And Nigeria is such a huge country with so many people. We are a great market that, could really be leveraged on if only that data and those analytics are put together and put in place in a way that we're able to shape that information to really help us to improve the availability of commodities. We also see that tools are siloed and really largely look at public sector data. And so we have things like the Family Planning Dashboard, DHIS2, NHLMIS. All of these are mainly public sector data. If we consistently look at public sector data and ignore that private sector aspect, we're, as I said, missing out on this huge component of data that could really be tapped into and be harnessed to help us to have a full picture of what our market really looks like. And then there's also the capacity issues as well. There's definitely a need for capacity to be built to move that forward. And then we also have some partnership related discussions. I think I will wrap up in that some of this has been presented previously, but currently SEMA is looking at scaling up this work and looking at the national level. What is happening at the national level and conducting a national level assessment across the various, across the national level to understand, what does our market look like and what would our proposed solutions to improving market access and availability. And that's one of the key things that we're doing in the next few months. There's also going to be a focus change to also add on additional scope of reproductive health and not just looking at family planning commodities. This is because RH is an area that definitely has a wider gap in terms of states procuring theirs and, not having that overall control as we do for family planning. And so it's definitely an area that the national level market would be looking at. So at this point, I think I'll hand over to Alexis to just quickly speak to us on the private sector data. Over to you, Alexis.
Great. Thank you, Amina. Hi, everyone. And I don't have slides. I'm just going to say a few words, I think, building on what Amina had just presented on about the ongoing work and what had been found preliminarily. And then I think in the January meeting, Ibaranke Dada had presented on early findings from our market assessments in the 5 states. And I think one of the things, even as those assessments and development of market strategies are ongoing, One of the major findings and unsurprising gaps is around private sector data. So I don't have anything to present yet, but just to tell you a little bit about what we are doing to try and look at how we might start understanding more about what happens with SRH products through the private sector. In 2022, we did some exploratory work on looking at export data to understand how we could better see the flow of products from countries of origin and production into markets such as Nigeria. So that is, we did last year just a little pilot of looking at a few different types of products to see what that could tell us, and it is promising. So we're continuing to build that out as a source of data for the portfolio of SRH products to understand not just for Nigeria, but also for other countries where we're seeing the movement of products. We're also in Nigeria working closely with Maisha Meds, and I think Dan Rosen's not on this call, but he may have presented on the Tanzania call that I missed, which was the last one. But looking at how they can expand their point of sale network into 3 additional states where SEMA is working in Nigeria. So we can start to understand what's happening there through the private sector, what products are flowing, what are the sort of some of the different pricing and trends we're seeing through that data, in addition to looking at other states where Maisha Meds is already working and continuing to expand their network. So that's been a really, I think, an interesting way to start triangulate some of the data that we have, knowing what's happening in the public sector, comparing that to what's being exported to Nigeria as well as other countries, and then trying to then see which products are flowing through Maisha Meds network, at least to see how we start tracking the flow of products through the value chain. So that's the quick update. Hopefully on a future call, we'll have more concrete data to share, but just wanted to update on that. So thank you, everyone.
Thank you so much, Amina and Alexis, for that, natural transition. I didn't have to come in. Thank you so much for that and for these presentations and thoughts. I definitely think, we probably will have some discussion on this issue of private sector data because, it keeps coming up. It was a huge sort of topic of discussion when we were discussing Tanzania as well. It's here in Nigeria, and I think across the countries, for those of us who are doing work in family planning, this question around private sector data, how much to ask for, how much to integrate, routine versus one-off data, feasibility, sustainability, etc. There's quite a few questions around data that I think perhaps we can go into when we are doing the discussions. To start off the discussion, I hope Ben is still around. There were quite a few questions in the chat for you, Ben. I'll start off with the first one from Monica, who says that she's really into the idea of changing this policy from donating to selling the products. This promises a sustainable solution for the future. Do you have an idea of when the policy will be put into action? Ben, are you still here?
Fine. Yes, I am here. I didn't actually hear what the question was. Can you repeat it, possibly?
I guess, Ben, just the question is, so when should we expect this policy to be put into action?
It's a very good question. I would hope that in some way, shape, or form, it will be rolled out later this year. So I wouldn't think it will be before. It will not be before Q3, and it may be later in the year. There may be a decision, if it's getting to the end of the year, to delay it until the beginning of next year. It's also possible that the rollout of the policy could actually be, if you like, piloted in a subset of countries. All these things are not decided yet, but I will be very happy to give an update on this as I've got more news in the next meetings.
Sure. Thanks a lot, Ben. Building off of that, there was also another question from Emeka, that who asked basically about what are the thoughts around the sustainability of this initiative. He's quite excited that, this idea of giving private sector commodities for sale, but what are the thoughts around sustainability of this policy or this initiative?
It's a great question. The idea of moving to a more explicitly commercial model gradually over time is specifically to try and develop more sustainable approaches. The current, I mentioned the donation paradigm that prevails in part of the market. There's a lot of support from UNFPA, and there's still, significant amounts of support from USAID in the form of donated products to countries. And part of the motivation for this strategy, this policy, is to be thinking much more explicitly about how governments can meet these needs themselves. The donor funding is beginning to go down. There has been donor sort of disengagement of this funding from certain countries, and that's likely to continue as lower income countries become lower middle income countries over time. So it's very much built with this idea of how can we help countries be more sustainable. Just donating these products will deal with the here and now of the urgent need for the products that are made available, but it's not necessarily best adapted to building markets that can be sustainable over time. So, as I said earlier as well, we don't pretend to know everything about the market. There are many, many moving parts. So one of the things that we'll be doing is probably doing operations research as we roll out the policy to see what levels of interest there is of implementing partners to use the policy, to avail of it. So there's a lot of questions that we don't feel that we have perfect answers to, and we'll be carrying on looking at. But certainly, to Emeka's point about sustainability and concerns about moving towards more sustainable approaches is at the heart of the motivation for the policy itself. Thanks.
Thank you, Ben. And the last question I think that I see in the chat for you is from Safia, who, along the lines of Emeka's question, is curious as to how engaged key family planning manufacturers have been in developing this new UNFPA strategy that includes selling the commodities, that includes this element of commercial sale. Has there been any engagement with the manufacturers?
So there has been some engagement, generally led by the supply chain management unit based in Copenhagen. But one of the things that we have been clear to stress, and I think I mentioned it in my remarks, is that in the event that sale is permitted, it would be below the commercial. It will be below the sort of like full commercial price. So we're really not trying to eat into that part of the market, but we're trying to understand if some more sort of differentiated approaches in terms of the availability of subsidized products would make a positive contribution to the market. One of the things in the past that was more common than it is today was social marketing interventions. There's not so much money for social marketing interventions. Social marketing interventions were obviously at subsidized price points, and part of this would allow, hopefully would allow some of the potential benefits of social marketing to get a little bit more traction in coming years. I think I'd be happy to talk to people about this. I think it's probably a bit premature now, but Safia, to your question, there have been various conversations. There will be others, and we'll be happy to engage with those of you who've got an interest in this. Certainly, I see this as something that hopefully will make a positive impact to market and the evolution of the market, and more sort of commercially viable elements to that market. There have been concerns in the past that the donation of contraceptives can depress the other parts of the market, and that's one of the things that we want to try and understand a bit better. Farhan, back to you.
Thanks a lot, Ben. I think that answers the questions. Tarek, I see your hand. Do you have a question for Ben or for one of the other speakers? Tarek, you can unmute and speak. We can't hear you. Okay, maybe Tarek is having some challenges, but in the meanwhile, I think we can move on to some of the questions that have been put there for Mopa. I know he's already started answering some of those in the chat. One of the questions was around the feasibility of, family planning products. And so Mopa, I see your answer here in the chat that there are specific requirements for the manufacturing facility depending on what family planning products you are wanting to produce. But I guess my question, sort of building off of that, is that are these conversations happening? Because again, I think there's this broader conversation about like research and development in family planning spaces, to come up with new, better products, and then of course to manufacture those products within some of these countries. I guess my question would be thinking about it, from and because we've been having this discussion from a stewardship point of view, like, is there anyone who is leading these discussions and, let's say, pushing for local manufacturing or family planning products?
Yeah.
And how is that happening?
So I think just to chip in here, like you mentioned in your last statement, there must be a leading discussion along that area to make it attractive for industry to look at those products, because the technical side of it is that you need to develop, build dedicated facilities for some of those products, because most of them are hormonal products, and there are stringent requirements on how you go about it. So there is the aspect of tech transfer and or R&D of such products. So these are things that if we come together as stakeholders, we can now come up with a roadmap that will lead to local production of some of these products locally.
Okay, thank you. Thank you for that, Mopa. And Mopa, because I know this also keeps coming up as a discussion. So what is the financing landscape for local manufacturing in Nigeria? Like, is it easy for people to access finance? Are there investments that are coming from the government? Are there other financial institutions that are looking to invest in that particular space? Like, what does the financing space look like for local manufacturing?
Well, I think there is opportunity for local financing. You have the Bank of Industry. You have the Bank of Industry, and the CBN still has a fund in that area to support the industry. As at the last count, the industry has not fully accessed all of what the CBN had earmarked for the health sector. So it's for players in that field to explore the opportunities that are there and then cash in on it. I think that aspect is still there, because we had a workshop late last year, because we are actually working on a pharma sector strategy for the country, and the representative from the CBN was clear that I think there is funding for local entities to explore and to their advantage. So I think that is there. In terms of offshore funding, I've not seen much of that. But then it's also another area where there could be such partnership with local entities in the country. Over.
Thank you, Mopa. And I think, generally speaking, there, of course, currently seems to be quite a lot of conversation and buzz around local manufacturing of, health products in general on the African continent. I think perhaps the task for, us as this group is to think about how we can sort of, as you mentioned, make a case for, reproductive health and family planning products, because that discussion currently seems to be leaning a lot towards vaccines and some of the other health products, but not that much on reproductive health and family planning. So it's just food for thought for the group to think about how we can sort of plug ourselves into some of those discussions. I see Denise has mentioned that GHSC PSM is organizing an African regional manufacturing webinar next month to discuss feasibility. FP is included, so please do share that link with us, Denise, and perhaps we can circulate it, to the group as part of an update from this particular discussion. And I also see that PSM IQVIA has conducted a study on the feasibility of manufacturing hormonal contraceptives in sub-Saharan Africa. So perhaps if you can share, that with the group as well, we can share it as a resource across the board. Thank you for that addition, Denise. Much appreciated. So I am looking at the chat. Meanwhile, if anyone has a question that they would want to, or any thought process that they would want to unmute and share with the group, please feel free to do so. Terek, I see your comment. Sorry for your microphone challenges. We at Healthy Entrepreneurs provide access to care with these products and NCD through community health workers. We have a ton of data in Southern Africa and are about to start in Nigeria. We found that by not relying on donors or organization, our organization has been able to sustain and scale. So definitely seems like an interesting conversation around, utilizing community health workers for some of this work, and then figuring out how we are able to make that initiative sustainable, because there are conversations regarding community health workers and how in many countries the governments also have challenges in terms of how do we hire them, how do we pay them, etc. So having, and I believe we even discussed this slightly in the Tanzania presentation as well, because Healthy Entrepreneurs presented there, thinking about how can we have these commercial private sector models for community health workers so that they can provide these services at the last mile, but also make themselves sustainable. So, happy to have that conversation. I did see on the chat that quite a bit of exchange of emails and all that is happening, which is great. That is what we want to achieve as a group, to create these connections so that people can talk to each other, share resources, share information, and just come together to work. So great. Please do get in touch with each other. Okay, I think a lot of the discussions have already happened on the chat. I don't know if there's any question that I'm missing. Andrea, have you seen any question that perhaps I might have missed from the chat?
No, Farhan, I think you've been capturing it all. I just wanted to jump in and, of course, thank all the presenters. And I think this demonstrates that this is a valuable approach, which we're really happy about, because we're interested in having this sort of community of practice and facilitating dialogue at a country level. I noticed that a number of people have weighed in on this topic of private sector data, and as Amina presented about data availability and this lack of total market data, and then others are working on it from various angles. This topic of market data, of course, is not a new one, but it also strikes me that this might, we would encourage if there was some sort of limited duration team or some type of effort that wanted to form out of this. That's certainly part of the goal as well with the community of practice. So we would, obviously you don't need our encouragement, but we would want to encourage that if various implementing partners and colleagues that are working on the topic of data want to come together in some way, and if we can help facilitate that, we're happy to do that. But it seems like this is something that SEMA is working on, FHM Engage is working on, various other partners. And so certainly many hands make light work, and the goal of always preventing duplication and sharing resources, I think, is a great one. And I noticed also that Julia White from RHSC is on the call, and also thinking about what practices or opportunities we might observe from the public sector and efforts like Global VAN. So just wanting to encourage, sort of this group like crowdsourcing that might come about in terms of developing and sharing solutions, I think is fantastic. So Farhan, back to you.
Thank you, Andrea, for that. And I'm thinking maybe, just as an idea, one of the things that we can do is when we share out the summary for this session, I don't know if we want to put maybe a small Google form for people who are interested in coming together and working on this, data thing. I mean, of course, they can always send us an email, but then sometimes I think having these, quick links that people can fill, and then we can see how to coordinate some of those conversations.
Yeah, that sounds good. And if anyone in the group has ideas, please, put them in the chat or just let us know, and we're again happy to facilitate moving forward. One thing also that we're doing with the community of practice, and just want to do it an open invitation on the fly here now, if there's anyone on the call who has something they're working on or some news to share about Nigeria who didn't present today or in the January call, please feel free to raise your hand, because we also want to encourage very informal updates on the country being discussed.
While people are thinking, just to thank MOPA. I don't know if he's dropped off already, but that was a great presentation, MOPA, and a great sort of area of work that is being done. I think local manufacturing of some of these products will go a long way in ensuring access for these products, especially on the African continent. So thank you for that, MOPA. I see a lot of discussion ongoing about data and all that. Amina, is there something you would like to, just clarify over speech rather than the chat conversation that's going on?
Hi, so I think I've answered most of the questions, but yes, we've reached out to, I think there was a question about if we had reached out to the third party, like private sector, to get some of that information from them that we were searching for. And we have done that. There have been conversations with a few of the SMOs in country. And then I saw Denise's suggestion about IQVIA. And I definitely think that that's something that we would look further into to try and get as much data as we can, if possible, from IQVIA as well, to give us that additional context. I had also just mentioned that, from the private sector, there's also that perspective of a lot of these SMOs in not wanting to be as transparent or wanting their data to be anonymized once it's collected, specifically because giving out that information shows kind of like visibility into their market share. And for the competitive nature that, the private sector has, that could also be an issue for them. But we've been anonymizing the data that we've been collecting and consolidating them as a whole, and not necessarily like attributing any information to any specific SMO in a bid to, like, you know, build trust and have them share that information with us. So I will definitely reach out to, I think it'd be good to connect with Denise on the link with IQVIA. I know that we've started having these conversations with them, but just to see if there's any previous information or any historical information they have that they could also share that would be useful. Over.
Thank you for that, Amina. And I mean, you know, I keep on, you know, on a personal note, grappling with these question of, you know, how much data do we need to ask for from the private sector, how it is being used for decision making. And I think, you know, one of the things that would be interesting to hear, if there's, you know, already people on the session today who've done this kind of work, is can we hear of any sort of examples or cases where, you know, some amount of private sector data integration has already happened and has been used to make certain kinds of decisions? I think, you know, as a group, if we are able to document some of those success stories as well, I think it would be useful. Are there any examples on the group that people want to share about that? And you know, it may not necessarily be from Nigeria, but even from other countries, like just in terms of having case studies of how this has been done and has led to some sort of improvement in the market. Okay, I take it that we have no examples of that kind of integration and use for decision making. And I mean, I wonder if that is one of the challenges, right? That we keep sort of grappling with this question of private sector data because, you know, we don't really have good examples of how that has been used, because I can only imagine that would help get the trust of the private sector if we had some of these examples. Yes, Alexis, please go ahead.
No, I just want to say I completely agree with you. And I think trying to find out what, I think it's been this idea of it's such a gap and we're missing it and we don't know, but we don't, until we have that data and can start pulling it together and finding out what's useful, it's a little bit of a chicken and egg. So I think it's certainly something we want to explore in terms of what is enough to be useful, what does good enough look like, how can we make progress, and what is progress and what's sufficient. So yeah, it'd be great to hear if others have sort of ideas or experience with this, but to say that I completely concur around how we define what is enough and make people comfortable with the notion of sharing their data in a way that's not seen as anti-competitive or in a way that jeopardizes their own business, but instead improves opportunities to understand the market and opportunities to actually make the market work better for more people. So thank you.
Thank you for adding to that, Alexis. Cindy, I see, you know, do you want to just tell us a little bit about, you know, this example that you're talking of?
Sure, Farhan. I haven't looked at it recently, but I mean, I actually think there are a couple of examples. I was multitasking as you spoke of as you asked your question. So, but one of the things that Palladium did under the ESHE project was a lot of actual stewardship work with the Ministry of Health, Kenya, helping them to quantify the private sector's contribution to the family planning and reproductive health market, and using that data to help make strategic decisions about what the resource gaps were for family planning commodities, and sort of support the ministry in some of that stewardship dialogue. So there is a case study on the Kenya experience that I'm happy to share, and I think there are some other examples, perhaps from the Propel Health Malawi work, where we were successful in getting the private sector to share their market data, specifically to be able to understand a little bit more about what the total market for some specific family planning commodities look like. So there are a couple, I think there are some examples out there, but I as I said, you caught me off guard and I was multitasking as you asked your question. Over.
Thank you so much, Cindy. Thank you for that. And I mean, I see a lot of people writing on chat that they may not have any examples to speak of today, but if you do have some papers or reports or anything that you are able to share with us, I think it would be great for us to share them as a group. And then depending on the countries where the examples are from, when we do come to those countries, as we highlight them across these community of practice sessions, then we can even have more specific presentations about that. Just quickly, Andrea, I saw your hand up first, and then I'll allow Cindy again.
Yeah, thank you. And I was just going to add in to what Cindy said as well, that when we think about private sector data, often the trend lines, right, showing the growth in product sales or volume over time overall for a given market, as well as by product category, can really help to motivate the private sector actors to think about the opportunity in the market. So whether it's an importer or wholesaler or a manufacturer, to say, oh, product preference is shifting from condoms to pills or this sort of thing. So that's why I think aggregated data over time shows the potential of a market, is one component. But that definitely presupposes getting data and then being able to build data over time. Yeah, back to you, Farhan.
Thank you, Andrea. Yes, Cindy?
Sure. Just a last question for the group. I mean, one of the things that we've been thinking about, and this is not something that we've worked on really, but I think it's an interesting question for the group as we're all grappling with collecting data around the family planning and reproductive health markets. We've also been thinking about how can we use machine learning and artificial intelligence to support some of this market level analyses. And Palladium, under the DataFi project, sponsored an innovation challenge where they reached out to different AI machine learning organizations and asked them to do a market segmentation analysis based on existing data, and it was kind of an interesting case study. And I've been thinking about how we can use that kind of approach in family planning and reproductive health markets. I think it would also be really interesting, and maybe that's an opportunity for all of us to come together and combine resources and think about how to be using that type of data collection tools as well. So just food for thought.
And very interesting food for thought, Cindy. In fact, some might call it a Pandora's box, this whole discussion around, AI and ChatGPT. Very, very fascinating, and something that, again, interests me personally quite a bit. But yeah, we can definitely consider that for, future sessions as well, see how we can incorporate that. Cindy, just a question. So this innovation challenge, was it country-based? Was it global? Just so that as the community of practice, we're thinking about whether we can fit it in within one of the country focuses, or maybe have it as sort of an independent short presentation or something like that during future sessions.
They started it as a global challenge. And again, I'm trying to remember all of the details. And they basically offered, I think they offered a grant of $50,000 for organizations to respond with different methodologies on how they would do a market segmentation around HIV products and services, with an eye toward trying to get a better understanding of consumer profiles and willingness to pay for services. And they ended up getting responses from several different organizations. I think Frame was one of the grantees, and then can't remember the name of the other South African based organization, but they ended up doing it for South Africa and Kenya. And I can share that case study because that has actually been developed, disseminated.
Great. I think that would be great, Cindy. So if you can share it with us, and then we'll have a discussion, and then maybe invite you for a session in the future, depending on when we're talking about Kenya, or maybe just again, as I mentioned, as sort of an introductory prelude to one of our sessions. Okay, I see we are inching towards end of our time. I'll just take this opportunity to thank all of our speakers today, all of the contributors. I think they were great discussions. Once again, lots to do. We look forward to hearing from everyone. Please do share some of these materials and do share your interest in forming this group around discussions related to data. Yeah, so thank you, everyone. Andrea, over to you to close.
Yeah, thank you, Farhan. And again, this is fantastic call today, and thank you to the presenters and all the discussants. We are planning the next session in May will be on Pakistan. So stay tuned for that. I'm not sure if we'll need to adjust the time slightly, but Elizabeth will keep us all posted on that. So thanks again to everyone, and a huge thanks to Farhan for facilitating so well. Thanks, everyone. Have a great day.
Thank you, everyone.
Thank you very much. Have a good rest of the day.
We're back.